If you've got pregnancy sciatica pain, then try to get comfortable with me and join me here down on the ground on a mat, because we're gonna go through some gentle low back and glute stretches to help alleviate sciatica pain in pregnancy. We're gonna start on all fours in a child's pose position. So I want you to bring your heels together, make your knees wide so you can really get your belly into this nice deep child's pose stretch here. And while you're here, I want you to relax every muscle of your body. And I want you to think about relaxing your jaw. Just open your mouth gently. I also want you to relax your eyebrows. A lot of times we do hold stress in our facial expressions. Take a nice deep breath in. Exhale through your mouth. I want you to audibly hear you exhaling through your mouth as you're in this stretch. Now I want you to walk those hands, Now I want you to walk those hands over to the left. So what you're gonna do is bring those hands over to the left as far as you can. At the same time, your hips are shifting back toward the right, or even on a diagonal, if you will. So you should feel a stretch in the low back right side. And again, while you're here, release any tension in your pelvic floor, in your jaw, in your eyebrows. One more breath. And let's walk it out to the right. And I think this goes without saying, mamas, that if you feel more pain, then don't do it, right? We want to ease up if you're feeling more pain. Obviously, we're trying to alleviate the pain and not create more pain. And again, in this side, inhaling through the nose, exhale through the mouth. Last one. And let's bring those hands back to neutral where we started. From here, we're gonna get into a thoracic spinal twist. So what I want you to do is sit on the side that does not have the pain. So I'm gonna sit on the right side, meaning my left side is where I'm having those sciatic issues. And so I'm gonna lie down. Obviously, if you have the pain on your right side, you're gonna lie down on your left, okay? So we're gonna lie down. You can bring that head just right to the floor. And what I want you to do with that top leg, that leg that feels the pain, I want you to bring it up to a comfortable position where you feel a nice stretch, where it's not causing you any more pain, okay? So this should feel good. Again, if it's not, we wanna avoid it. What we can do with your hand, you can leave them here, but what I like to do is get a 2-for-1 in this stretch. I like to bring out both of my arms and then use my head and look away. So I actually do feel the stretch in my glute even more, but I'm also feeling it into my mid back. And so this one feels really good. So any moms who have any tension, maybe pain in the mid back, then this is also a great stretch to do for that. Now, if this is too much for that knee, you could even prop it up onto a pillow, a foam roller, something like that. So just giving you some options here. And again, I want you to breathe into it. We want to stay in these poses for a minute or so. And we're trying to relax, right? We are trying to relax to alleviate that pain. We're gonna slide that knee down and we're gonna bring that arm back. All right, and we're gonna slowly prop our body up and we're gonna come into a modified runner's stretch. So for this, if you need extra support, I do have a chair with me. You could use a birthing ball, you could use anything for help. So we're gonna do this on both sides. And yes, we're stretching out our glutes. We also need to stretch out the front. So our hip flexors. All right, so what I want you to do is we're gonna bring one knee forward. I'm starting with my right. Doesn't matter because we're gonna do both sides. What I want you to do is do a slight pelvic tilt up. So think about that pubic bone coming upward, and right away you should be able to feel that stretch in that hip flexor. Now what I want you to do is engage that glute muscle, okay? So this is the leg that's kneeling on the floor. We've done our pelvic tilt, squeezed our glute muscle, and from here I want you to be looking forward, and already you can feel that stretch. The chair is for support if you need to hold on to something. What I'm gonna do to feel this a little bit deeper, I'm gonna be toe heel, walking out that front foot. Okay, as soon as my foot gets here, I feel that stretch even deeper. But it feels good, and that's what I want. I want you to feel good, not worse. We want to feel good. So this stretch feels really nice down the front of my thighs. We're breathing through it. Nice job. And then what we're gonna do is bring that foot back, slide it back. And to get that stretch a little bit deeper, I want you to bring both hands up overhead. Now you can't see my arms, that's okay. But think about this leg that's out in front. This is my right. I'm going to take those hands and I'm gonna lean over towards the right. Just so you know, my hands are interlaced together like this. So now I feel that stretch even deeper. Again, if you need that arm, hand for support on that chair, that is fine. And let's come back. Bring the arms down, untuck the pelvis, and that stretch feels great. Let's do the other side. I'm gonna move it over here just so you can see what's happening. And this time, my left leg is coming forward. We do that gentle pelvic tilt, glute squeeze on the leg that is kneeling on the ground. Feeling that stretch here, and right away, if you know you want to toe heel, walk that front foot out to feel that stretch. A little bit more, go ahead. And from here, you can take both arms up overhead or just one, and nice gentle lean over. Don't let go of this pelvic tilt, don't let go of that glute squeeze. Nice stretch here in the front. And toe heel or slide the foot back. Nice job. We're gonna come down onto the ground into a seated position, and we're gonna get into that low back, that QL area. I'm gonna come onto my side. What you're gonna do is you're gonna take your left hand, palm facing up. You're going to slide that left hand out. All right, I only want you to go as far as you can. I don't want your right butt cheek or your right sits bones to come off the floor, okay? So only slide that left arm out as far as you can, that's comfortable where you feel that stretch, by keeping that sits bone down on the ground. Now with your right hand, you're gonna reach and walk those fingertips forward. Again, those sits bones are staying on the ground. Feel free to drop your head if you'd like. And you should feel nice stretch in the right low back. This is your QL muscle, your quadratus lumborum. I love this stretch. Pregnant or not, it feels good. Feel free, that left hand that you've slid out, feel free to place the palm on the ground to support you. And slowly walk those hands back up. And then we're gonna switch sides and do it on the other side. Right palm flipped up. Nice slide over. And right away, I feel the stretch so much deeper and so much more needed on this side. And you might feel that too. And again, inhale through the nose. I want you to exhale through the mouth. Release any tension that you have in your pelvic floor. No squeezing. We want to be relaxed here. And then we're gonna slowly walk those fingertips back up. Ladies, and then we're gonna slowly walk those fingertips back up. And ladies, I want you to take these stretches, and if one just really resonates with you, you can do this every day. I mean, you could do this whole video every day. You could do, pick and choose which stretch you really like, and do them every day as well. All right, while you're here on the ground, I want you to bring both legs out in front of you, and your hands are going to be back behind you. I want you to bend your right knee. So let's not bend it all the way. We need to make room for baby bump here. So right knee is slightly bent, and then you're going to take your left ankle onto the right knee. And we've got a glute stretch here. Now, the further you are along in your pregnancy, this might not feel so great in this position. So feel free, if you are doing this position and it feels good for you, I want you to stay here. But you can also do this, and this is a great one for all those office workers. You can do this while sitting. Again, taking that right ankle onto the left knee. Other way around. Taking the left ankle onto the right knee, and we're just feeling this stretch here. Now, if you're doing this in a chair, what I really like to add on is a little rotation. So looking back, it doesn't have to be much, but again, that feels good in the back. And bring it forward. Now, in this stretch, you do not have to be pressing down. That might cause too much of a stretch. You can actually bring it up. So play around with it and what feels good in your body. All right, same thing on the other side. Since I'm in my chair, I'm just gonna stay here. If you're still on the ground, stay on the ground. All right, this time, right ankle comes up onto the left knee. And we wanna keep our body upright. We don't wanna be hinging into it. That will likely make it a bit worse. And we don't obviously want. Now in this position, we don't wanna be hinging forward. I know you might feel that, the deeper I go, the better it might be. Now in this position, resist the urge to hinge forward. We don't need that. We don't need to go that deep. I want you to stay upright. And again, if you want to lift that knee in towards you, you can. And I'm going to take that little twist here to a range that's comfortable in your body. Again, inhaling through your nose, exhale through your mouth. Relaxing through it, and bring your body back. Nice job. All right, last couple stretches on the ground, and we're gonna start out on our knees in all fours. Palms are directly underneath your shoulders, and I want your toes curled under. So what we're gonna do from here is curl our toes under, and I want you to exhale as you straighten up those knees. Bum comes up towards the sky and hang out here. Okay, so this in itself should feel good. From here, I want you to walk your feet out. So you're going to bend the knees, bring your feet to a distance that is comfortable for you. It can be wider than hip width distance, obviously making room for baby. All right. Here's what we're gonna do next. I want you you're on your toes. I want you to swivel your heels out to the right and swivel your heels to the left. And again, to the right and to the left. Again, a stretch that comes all the way up to your low back. So you might feel really good doing this one with that sciatic pain. Bring those knees back to the floor. Quick child's pose. Nice relaxation breath here. And come out of that when you are ready. Now I want to touch on something. The reason I always talk about relaxing, right? Getting rid of any kind of tension in your pelvic floor is because a lot of times when we hold tension in our pelvic floor, pain is accompanied by that. Our pelvic floor muscle needs to be able to contract and relax like every other muscle in our body. It should not be tight and tense all the time. I want you to pay attention to when the time of day that you feel that the sciatic pain. Is it after you've done an evening workout? If so, perhaps change your workout to a different time in the day. Is it when you've just done a long walk? Perhaps shorten the walk or change the time of day. Is it when you're stressed and anxious at work? Right? I want you to pay attention to when these things are happening because likely the pain could be minimized with lifestyle changes. And I want to give you one thing that you can do during the day besides these stretches that you can do to help put your body in a more relaxed state. So we have our chair here. You're gonna come down and come down on your side, and then we're gonna lie on our back. Now, yes, you can lie on your back during pregnancy, 5 minutes. After 28 weeks, 5 minutes max, okay? And from here, again, I want you to pay attention. Focus on what is your pelvic floor doing? Is it tight? I want you to relax. What is your eyebrows doing? Do you notice the frown lines? We don't want frown lines. Relax. And do we notice our teeth clenching together? I hope not. We want to be totally relaxed here. So put a timer on. Maybe you want to spend 2 minutes in this position and just relaxing your body during the day when you feel stressed or whatever it is. And this will help to alleviate some of the tension that you're holding in your body, which will hopefully alleviate some of the sciatic pain that you're dealing with. Now, if you want to hear more about these lifestyle changes that you can make, I interviewed Sinead Dufour, and she is a pelvic floor physiotherapist as well as a pain researcher, and her and I talk all about these lifestyle factors that most of us don't know that can actually really make a change in minimizing our pregnancy pain. So if you're interested in that video, check it out right here, and I'll put the link down below. And ladies, thank you for joining me in these sciatica pain relief stretches. I will see you in the next one.